Thanks very much. I'm very pleased to be here with you today. It's a really important topic given the impact of COVID-19 on a whole range of health issues, but particularly for our focus on HIV and key populations. So it's a really important time for us to be talking about differentiation, service models for delivery of services in terms of both treatment and prevention when we look at the context and the lens of inequalities today in Asia and the Pacific. So I'm going to talk about these areas and talk also about how we're going to see changes as we go forward. So without further introduction, we'll go straight into it. And I'm looking forward to the discussions that will follow. The first issue to look at is the whole approach to testing. Where are we at across the region? On the right of this slide, you can see 3 countries with very low levels of treatment as well as low levels of testing. So the combination is explosive for their epidemics. Challenging in a country like Malaysia, which has a strong health system, yet the transition from knowing one's status into treatment is still a major challenge. This reflects an issue that affects a number of other countries, and it's particularly around the issues of stigma and discrimination and fear of exposure of what your risk behavior was within that setting. So Malaysia is doing a lot of work on the issue of stigma and discrimination in the healthcare workforce so that people are more understanding and accepting of the clients they need to work with. We have other issues across the spectrum here where the transition from testing into treatment is still quite low, even in strong responses. And then we have the other issue like Papua New Guinea with one of the world's highest levels of drug resistance to ART. And yet it seems on this slide to have a very strong level of testing and a small gap, which does not reflect the reality. So data is sometimes not up to date or best reflecting. And so one needs to dig down country by country, which of course we can't do today, but this is something to be looked at for a whole range of different countries here. It's really critical that we understand treatment and prevention coverage. So when we're looking at this slide, we're seeing here the issue around treatment access and treatment, people on treatment. You can see in the left hand in red, we still see the same countries having some challenges around access to treatment. And these are significant concerns for us, both for onward transmission of HIV, but for people's health individually. We are having progress across the region, good achievements in many countries, but we're still behind global trends and we're not meeting the 2020 targets for Asia Pacific. And so this is a serious concern for the region. There is slow incremental improvements in treatment, but not at the scale that we need to respond to HIV. The treatment cascade, the 390s targets, is another way of looking at the issue of both testing and treatment. And you can see here the gap, the progress, and we still have significant gaps, both for people knowing their status and then the transition from knowing status and straight into treatment. It should be same day. It's not in many places, and this is causing a significant issue. It also is about the underlying issues of stigma and discrimination. Why are people afraid to step forward when they're still feeling well? Why are they afraid to step forward and go into treatment, which will keep them healthy for as long as anybody else in society? So there's big issues around treatment access and comfort with access. There's issues with quality. When we look at viral suppression, this is still a big challenge in the region because many people are only getting viral tests once a year. So it's not as effective as we'd like to see it, when then it could be used for U equals U. So if someone knows their status, has achieved viral suppression, then they are no longer transmitting the virus. So this is an important piece of the knowledge for both prevention and treatment that people need to know. Combination prevention is critical. We are seeing some good improvements. PrEP, pre-exposure prophylaxis, is starting in a number of countries, as you can see from this slide, but we're not at the scale yet. We need high coverage in each of these countries before it's having an epidemic control factor. It's the mix of behavioral, the biomedical and structural approaches that are needed. And I'll turn to a couple of the innovations that are required to really scale up. In many ways, we can see both prevention and treatment have stalled. And it's a little of the stagnation of some of the programs that need innovation and change. Disruptions have occurred during the last 12 months and longer now with COVID-19. And you can see from this slide, comparison of the first 6 months of 2019 with the first 6 months of 2020 and the impact on treatment scale up, and it's significant drop behind, and we're seeing this globally. Some countries are seeing a setback as much as 10 years in their responses by the interruption of services. This is partly because of lockdowns. It's also partly about diversion of healthcare services to focus on COVID. And so we're not having the access to the treatment and to the testing and prevention that's required. This is another way of looking at it. Here's the issue of harm reduction, and you look at Cambodia, the serious drop-off in services, and this is a critical issue for us in the region, that there was big interruption, potential of increased infections in a number of groups, and that's continuing in lockdowns where people's behaviours and access to services are continued to be interrupted at short periods or longer periods as the COVID epidemic is impacting on countries differently at different times during the year. So there's another way of looking at some of the services that have had the interruptions. The barriers that people are facing. One of the first barriers is access to testing. And if you're a young person, and those of you who know, in Asia Pacific, we're seeing second wave epidemics across the region. Many countries, Malaysia, the Philippines, are seeing high numbers of new infections in the young, under 25. The Philippines in particular, you can say, with the fastest growing epidemic in the region and one of the fastest in the world, majority of its infections are under 25, and it's like a totally new epidemic amongst the young. And so Philippines positively has changed and brought down the age of consent, so people can access services on their own without parental consent earlier. But you can see across the region, it's still a challenge for many countries. And so this is a concern. This is one of the things that need to change. Other issues here, the enabling environment. It's the issues that we're perennially chasing and facing at country levels around human rights, access, the role and the rights of key populations in societies. And this, we're seeing a rising conservatism across the region. So this is a serious concern. You can see on this slide a range of the issues that people from the key populations are facing in their everyday lives, which have been exacerbated by COVID-19. We have evidence of much higher levels of community-based violence or domestic violence against people from key populations who are being forced in longer periods to be in home settings or different settings to their usual. The laws in many countries still criminalizing aspects of the program. There have been some good changes. India struck down the old colonial law from the 1860s criminalizing same-sex behaviors. That will make an impact and a change as taking away the legal barrier changes societal both practices and understandings. And so this also takes away a whole range of barriers to access to services and a sense of self-worth and identity. Comprehensive HIV legislation, new in the Philippines, really significant new law there, many positive changes. India as well. Transgender Act in Pakistan, significant. But many times the law on the books, the law itself is not then matched by actions in the streets. And so we're still seeing high levels of gender-based violence in many of these countries and murders of transgender. So serious issues in society to address. Transition is still an issue from compulsory centres for drug users, where they're largely not accessing any effective treatment models, and care in the community. We're seeing big changes in terms of opioid substitution therapy with take-home doses and multi-month dispensing approaches in a number of countries. Vietnam, Myanmar, we're doing some really good work on this. Political commitment's critical. In summary, stigma and discrimination within healthcare settings are keeping clients away. And now this is being increased in a number of our countries with community stigma and discrimination and conservatism in politicians impacting on behaviours. High out-of-pocket expenses, of course, and when you add COVID-19, this is significant because a lot of people have lost their employment, so out-of-pocketing expenses are much harder to be able to afford, and we've also seen people not able to access physically the services they were used to receiving. Some of the regimens really need to be updated TLD should be available in all countries, but not yet. So there's still a long way to go for these changes. Evolution, though, is occurring in some of the treatment delivery models. It's slow in places, but we are seeing some really good examples. In the area of testing, you can see there's different types of testing. The self-testing is the one we really need to see rise, and the lay testing, but particularly self-testing when people have barriers to access services and fear and stigma to counter. They can test themselves, and it can be online. That's where most of these services need to be provided, as well as community-based or lay provider. How are people meeting today? Young people are using the internet, mobile phone technology to meet socially and including for sex. And countries as diverse as Papua New Guinea with a limited range of access to internet or to mobile phone, right through to Timor-Leste. The Philippines, significant. People are using platforms like Twitter, and they have clans of 1,000 young people in Twitter groups where they're all accessing both to meet for social engagements, but also for sex. There is an issue here with, of course, online. Those who are seeking sex can find it easier and then are at greater risk when they're online. And so it's not about the platform they're using, because as I said, there's Twitter as well as some of the more targeted platforms. It's getting information to the people who are in this digital world. And that's the young in particular. That's why we've seen rising infections, because a number of the programs in countries are the old walk-in style, whereas people are accessing the information online and don't go to the fixed site. So we have to update fast the programs in many countries. The virtual interventions, this is significant. It's a revolution for the programs where it started to be used. There's phone counseling. I was in Mumbai and saw people there who can access test kits sent to their home. They do the online counseling, and then they work through the options as based on the results, both how to keep safe and then access to treatment if required. There's a whole range of options here that are being used. Case management, the telemedicine that's being used, and COVID has actually given opportunities for an increase in this. What we need to see is that it is maintained after programs might think they're returning to the old normal, which is hard to see in the short term. But we need to maintain and scale up innovation through the types of service delivery, particularly virtual interventions. So as we move forward, new global roadmap, the global strategy. This is not a UNAIDS strategy. This is a global aid strategy, particularly the inequalities lens. One of the biggest barriers is the issue of inequalities. Those who are least able to access, take precautions, protect themselves, have rights in societies, access, prevention and treatment are the ones that are facing the biggest issues and are most vulnerable. We need to look at the domestic financing, social contracting. We're seeing a breakdown in the services as donor funds withdraw, and we're not seeing the increased resources domestically to ensure that social contracting with civil society to make sure prevention is part of universal health coverage and other issues. So the new strategy sets a roadmap for all of us as we move forward. Priorities for us in this region: to renew and intensify the focus and the policies on rights-based, reaching the key populations where they are. Again, this is why the internet is such a valuable tool for this. Modernizing the programs, PrEP, self-testing, the multi-month dispensing, not just of ARVs, but of opioid substitution like methadone. There are a whole range of things here that need to be changed, and in the context of the virtual space. Barriers to access. This is really an important issue around stigma and discrimination. That's from the first entry into the clinic setting or the hospital setting, right through to the service providers. So it's really important. The domestic financing, both particularly for prevention, but the role of civil society as part of universal health coverage for HIV as well. Healthcare providers, as I said, multi-month dispensing, the take-home models, the virtual interventions. We need to advocate for services, particularly prevention in UHC, using the most up-to-date science for treatment. Why does it take so long to make changes in policy to allow more effective and cost-effective as well treatments so that people have better lives and society and the government budgets are able to go much further? non-traditional methods like the social marketing and franchising. We need to look and relook at the innovations that were part and parcel of the response in Asia and the Pacific 30 years ago. We really need a revolution of approach to service delivery. Stigma, I've talked about, and it's critical because that's the single most significant barrier, but it's not just the healthcare settings. It's also stigma that's been created by politicizing the issues that we take to heart and are most critical for the response to HIV. And we're seeing that in a number of countries where key populations are being victimized and blamed for many things, including COVID spreading in some places. So this is a significant issue for governments to address. Thank you very much. I look forward to the discussions.